Hello, everyone. Welcome to our third discussion in our series of 4 on CMS's health equity physician fee schedule changes for 2024. So I am going to share my screen and let's see if we can start walking through this presentation. Melissa and I are really happy to have you today with us. For those of you who are new, we are the founders of the Bridge Health Advocates, where we train medical professionals to work as independent patient advocates. And we just love learning and discussing and, bringing people in to talk about all the different changes that we see in healthcare, especially those that can benefit our patients, benefit our clients, and can maybe influencing how we work as independent patient advocates. So here we are. So just to jog your memory a little bit, there are the 4 new services that are addressing health equity by CMS. There's a caregiver training services, social determinants of health risk assessment, community health integration, and the principal illness navigation. So in case you missed it, we talked about principal illness navigation in the second discussion that we did, second video. That was the most recent one. And today we are talking about community health integration. And so I know Melissa has a lot to say about this. And so we're going to get to the next slide. And Melissa, so just tell us a little bit about community health integration.
Sure. So what this really looks like is a patient, right, goes to an appointment with their provider, and that provider does a social determinants of health risk assessment, which was mentioned on the previous slide. So with that assessment, if that provider shows, that there are social factors that are actually affecting their patient's health, they can go ahead at that time and initiate community health integration. So it really starts with an assessment that the provider does. And if they identify, yes, there are factors that are contributing, probably not to the benefit, right, of the patient,
Right.
that they go ahead and initiate community health integration. And what that looks like is that most likely somebody from their office, or we'll talk a little about who does this, but somebody is identified to perform these services. So they may be called community healthcare workers. If they're from a provider's office, they can go by various names, but these are the personnel that are actually implementing the community health services. And so what does that sort of look like? Is that person will do an assessment, and they're truly trying to understand, okay, what is actually going on with this patient? And at all times, they're trying to, address those social determinants of health and thinking about, okay, what's a plan that we can implement that's actually going to improve their overall health and well-being. So what those services sort of look like is care coordination, providing education and resources for the patient. At all times, you will see that CMS, this is where we're getting our information from, is they talk about self-advocacy. So this personnel, this identified person is actually making sure too that they're teaching the patient how to advocate for themselves today and in the future. And this person ends up becoming really a support person for the patient, and also communicating with the provider who actually initiated the community health integration. So that's pretty much it in a nutshell.
Yeah, perfect. Perfect. Okay, so tell us a little bit more about who's providing these actual services. What are the
Yes,
guidelines from CMS? What are they
right.
saying?
Right. So CMS guidelines, how they state it, right? It could be somebody external to this provider's office.
Mhm.
It could be somebody under contract. So the provider can utilize a contract with a third party to provide the services. It could be the practitioner's office practice.
Okay.
So really, it's up to us as consumers of the service, right? Is to better understand if a provider initiates community health integration, um, that they understand who's actually providing them. Are they actually in the office or are they at their home, right? Working directly under the provider, or are they in their home working for a third party contractor?
Mm-hmm.
And again, they're going to have various titles, and that's where it can get confusing, right? So some organizations might call themselves the community healthcare workers going to be contacting you,
Okay.
right? But in some providers' offices, they may identify themselves by different names.
Okay.
But just better understanding, oh, is this falling under, the community health integration guidelines?
So what type of training is required, recommended, for the community health integration provider, community health worker?
So at this time, it's really falls under the state.
Mm.
So you really have to know where the patient lives, right?
Hmm.
And is receiving those services. So going to your state and going, okay, what are the requirements? There is a requirement for training
Hmm.
and licensure.
Okay.
So that is a big thing. So we will be talking and diving in a little bit more into Arizona because that is where um, we practice, we live. The majority of our clients that we serve receive services.
Hmm.
So we have taken the time to better understand what are Arizona's requirements. But
Hmm.
again, you really need to look at the state that you're living in and have they been already implementing this and preparing for it?
Hmm.
And there are guidelines. And the
Okay.
training encompasses the following components that we have listed. But it goes over and it teaches whoever's providing these services, communication aspects, how to effectively communicate, relationship building,
Hmm.
coordination and navigation. Again, we talked about the advocacy component. Like, how do you teach a patient to actually advocate for themselves, right?
Hmm.
And how to do an assessment for the patient, and along with doing assessment of the community and making sure that the community has the resources that patient needs, because possibly you might have to go outside your community,
Hmm.
especially if you live in a more rural area and that community doesn't have what that patient needs. So
Hmm.
the training involves actually teaching those who are providing these services, whether it's under their state and following the CMS guidelines.
Hmm. So you have brought up a couple interesting points. So what I'm understanding is this community health worker has this kind of workforce has been maybe established, has been around a little bit longer than what we talked about last time, the principal illness navigator. So there are certifications, licensures in various states um, that you can receive. Whereas in this certification, a certification is required because it seems like even if you don't have it in your state, another state does. So you can do, you need to receive that certification or certification from somewhere. And if your state has a licensure, your own, you have to follow the one that you're
Yes,
living in um,
yes.
as well. Okay, so that's great. I mean, I think that's great that this is, seems a little bit more established and there is this training. The other thing that strikes me is how important it is, to know the community maybe and the resources
Mhm.
that they offer that the patient lives in. So I know we'll talk about this later, but you can do telehealth services um, for community health integration. And I just wonder how that all actually, plays out in reality if they are, the provider, the community health worker is, living, elsewhere, how involved, what does that mean for the patient and the resources that they'd have access to in their community? So it's just
And when
interesting.
I, yeah, and when I, when this even community healthcare worker, when you hear that term, it's similar to when somebody hears patient advocate. And for
Mhm.
us as independent patient advocates, right, a lot of times we need to define what we really are doing. Because when somebody hears, oh, you're an advocate, right? They associate maybe like, oh, you work for the hospital or you work for the insurance company. And so now we're sort of on the other end, right? We are utilizing community healthcare workers and asking, oh, can you tell me more about your position and your role? Who do you work for?
Mhm.
Because community healthcare workers, and I am just going to talk more about Arizona. I mean, we have had community healthcare workers here in Arizona for 20 plus years, right? There
Yeah.
are people boots on the ground who nonprofit organizations have community healthcare workers helping their communities,
Mhm.
right? We have now seen it evolve to where we are today, and that's where it can get more mucky and confusing. So is this a community healthcare worker that is implemented through my primary care physician, or is it community healthcare worker that was implemented through the state funding insurance, right?
Mhm.
Or was it a community healthcare worker because I live in this community and they have an organization who serves the community and sends out people, right, to identify and work with people who, have unmet needs in the
Mhm.
community. They're lacking resources to food and shelter.
Mhm.
So again, it's just a very general word. I'm a community healthcare worker. Tell me more.
Right.
That's
Right.
what we need to do
Absolutely.
is to better understand.
Yeah, absolutely. Those are great points, Melissa. Yeah. Okay. So let's take a look at their services. So we'll just dive into, what are the actual services that are provided? I think we have a couple slides on this by community health workers through, yeah.
Yeah. And again, it really depends, right, on who you're working with. And again, asking them, so can you tell me more about the services,
Mhm.
I will receive, right,
Mhm.
from having somebody work with me from your office
Yeah.
or, work with me from your organization. And these are all the services that can be provided. And really, it starts with, and what we know as advocates is doing an assessment,
Mhm.
right, of the needs for this patient.
Mhm.
And so what does that look like? It might vary from provider to provider, but an assessment has to be done. And this is where it's a good thing, right? Because it's a different type of assessment. It's not a medical assessment, right? Tell me what medications you're on and what disease processes, you have. It's really understanding what is going on in this patient's life, their personal story. And you sort of mentioned telehealth. Sometimes it can be hard to understand one story just over something like this, right? Sometimes it needs to be, gosh, I need to actually get in the home to truly understand what's going on.
Mhm.
What are their needs? Right? And then what are the goals? So what is the whole goal of, for the patient, for the client?
Yeah.
Um, and that's where it comes at like, what is the plan? Creating a realistic plan.
Mhm.
And at all times, and it does have to come back to that it is, since the provider is ordering it and it's coming under the provider, especially if you're following the CMS guidelines, and if this is being billed, right, under the Medicare guidelines,
Mhm.
this would differentiate between maybe a nonprofit group that is offering types
Right.
of services. But if it is being billed under CMS and following the guidelines, it does have to come back to that identified plan of the provider.
Mhm.
Okay. So, and then also that assessment is the big key. And then the next step is the coordinating. So now you've done your assessment, you've done your plan, and now it's that coordination. So making sure that they're getting to the providers they need, the services they need, maybe they need to have some testing done that isn't offered, around the block. And they need transportation for 45 minutes away to get to this, CT scan, things like that, along with that whole communication aspect of this person is now the key person, right, that is working with this patient to communicate back to the ordering provider, along with any other providers, caregivers who are involved in that care. That's really that coordination.
Mhm.
And as we mentioned, just making sure that they are getting all the services that they need.
Yeah. Well, I'm struck with all with
It's a
what's
lot.
on for services. It's a lot, but under that first bullet point in our person-centered assessment, I love that it says preferences and desired outcomes. And that's not the preferences and desired outcomes of the provider or the community health worker. That is of the patient. And I just feel like that gets lost so often.
It,
And I feel like the community health worker could be like, guess what? I'm going to write this out. This is going to be, documented. The provider can see it. I can communicate it to the provider, but these are their desired outcomes, regardless of,
yeah.
what the medical provider wants to do. So I like that. You're just giving them a
And
little bit more of a voice. And that's what
yeah.
patient advocates
And
100% do. But
yeah, and I've seen this here in Arizona, right? Is, you can go to an appointment and your provider says, you really need to be eating better, and you need to eat, healthier and lose some weight and this and that. And you really, there's a large cultural component, right? There's
yes,
a lot that goes to it. And
right.
just as an example, I've seen here in Arizona, it's we have a Hispanic, right? And it's like their culture is a lot of carbohydrates, right? Beans, tortilla. And I've seen actually where they go in the home and we can't change that, but maybe there's some modifications,
Mhm.
right? That we can teach someone who is struggling, right,
Mhm.
with, having health conditions, increased cholesterol, blood pressure, needs to lose weight. Say, okay, we're not going to tell you just to go eat fruits and vegetables and chicken,
Right.
right? But here's some modifications. And
Mhm.
that's the type of education that community healthcare workers are identifying and
Mhm.
then implementing. So again, they may not be the ones actually doing that education, but there's this great class that we would love for you to attend that actually, teaches you how to utilize what you're already used to eating, right?
Mhm.
And how
Mhm.
to do it maybe just a little bit different.
Yeah. Yeah.
So that's what I love about this. It's really
Mhm.
getting more into that personal, identifying um, those personal things, the culture.
Yeah, absolutely. All right, now we're on to the next, another
Okay.
slide of services. So yeah, these are all great things.
And we
So,
talked a little bit just right there about health education, right?
mhm,
And this is what we're seeing is with community health is we're getting creative, we're getting innovative, right? We're not, I mean, in my days, probably your days too, Jen, like when we would just print out a sheet, right? And we'd hand it to the patient when they would leave the office, and we would just expect that they would go home and read it and do everything on it. No, that's not where health education is. And we all know that in order to do effective health education takes time and resources and follow-up.
yeah,
And so that's why a big chunk of this is being put on this community health integration
mhm,
aspect, is utilizing personnel to do this education that we know is needed, along with at the same time teaching those self advocacy skills,
mhm,
which is just necessary, right? So having somebody, outside sort of work with the patient saying, okay, the next time you go to your provider, this is what, you need to talk to them about. You know, I've done these things, I'm changing this, but maybe you still don't feel well, or you're having an issue with a medication or something. Is teaching that self advocacy. And what we're also saying is it's not only the patient, but it's incorporating the family unit, whoever that may be, right? It could be non-traditional family units, but it's including other members of that patient's life in promoting advocacy. Uh, and again, the community healthcare worker really gets to know this person. And that's why it's just the one provider implementing it. So that is one of the guidelines I think we mentioned later on in the billing aspect, right? But
okay,
it's just the one provider. So you're not going to see multiple providers
mhm,
implementing community health integration under CMS. And because what they found is, and what we've sort of talked about, is we know that, it's already fragmented, right?
yeah,
With multiple providers. We sort of talked about that in PIN services, right? Chronic care management, you could be getting chronic care management, then you could be getting PIN from somewhere, still a little bit fragmented, right? But community health integration is really for one provider
Mhm.
to identify personnel to assist this patient. And therefore, it establishes more of that relationship
Mhm.
with the provider.
Okay, perfect. And on this slide, I'd look at the last, couple of bullet points that's facilitating and providing social and emotional support, which is phenomenal. I think that does take a, special person and some training to be able to do that in the right way. And then also they can leverage their lived experiences too. So are they part of the community, for the patient that they're serving, or have they done extra work in, XYZ area? And I just think that's great to be able to, utilize that person's unique, background to provide these services.
Well, all of these services, I mean, when they came out, I mean, for us being in the healthcare industry, right? It's amazing that we're finally identifying, right, that there is value
Oh, for
to
sure.
offering these
Yeah.
type of services because we know this is truly how you can
Mhm.
change one's health and well-being.
Yeah. So that's great. Great. Perfect on services. Okay. So now we come right
It's a
into
lot of words.
billing. No, but it's good. I mean, I think we need to know this to see really how does it work? What does it look like in reality? So yeah, tell us a little bit about the billing.
Yeah. And these are things that, even us as consumers, right? You really want to understand, okay, you're offering me this service. How is it going to be built, right? And again, so we're talking about the CMS guidelines,
Right.
our provider to
Hmm.
be initiating the services. So it really is incident to that billing practitioner.
Hmm.
Okay. And so you need to know that. Okay, so this practitioner, it does not, the community healthcare worker cannot bill directly. So if somebody's like working, no, that personnel can't bill. It's really the provider
Hmm.
who bills. So, and then a treatment plan has to be established under that provider, like we mentioned. And then we mentioned it could be external or it could be, under contract or it could be actually in the office. We talked about that telehealth is acceptable. And that is needed at times,
Yeah,
absolutely.
for sure.
But I would also just want to know that is there an opportunity to have sort of what we just say boots on the ground, like somebody that can go to the home or
Hmm.
that is at the provider's office and has face-to-face time.
Hmm.
So, it's just something as we're seeing this roll out, we're going to see it roll out, again, various ways throughout various states, right? We're going to go down to the state. But then, as we know, like living in Arizona, we have very urban areas, but we have very, very rural areas, right? But even if you look at that rural area, telehealth may be the only option, but yet we know that the most effective ways is when somebody from that community goes to that person in that rural area who understands living in that community, the culture of that community. So again, things you just want to be aware of is, how will these visits be done? Yes, they can be done telehealth. Consent always has to be done. I would always recommend written no matter what.
Yeah.
But naturally, sometimes maybe a verbal has to be done. Again, if it's maybe in a rural area, you're offering telehealth, they don't have access to sign anything, and the best you can do is verbal. We already mentioned that only that one provider can be doing the community health integration. It is billed at, the initial, that 60 minutes where they're doing the assessment, they're talking about the services, they're initiating it, and then in 30-minute increments. It will be billed, again, asking, how will this be billed? So if it is straight being billed under Medicare, and that is what we're seeing, in places, right? That they are utilizing this Medicare Part B benefit, right? And all of this information also can be found at Medicare.gov from the patient perspective. So
Mhm.
we know that patients can go to Medicare.gov and look and learn about what their benefits cover. And when you go there, it will say for that patient, after they meet their deductible, 20% of the Medicare approved amount. So there might be some, they may have to pay for these services, right? And so just want to be very clear and transparent before providing them or receiving those services.
Mhm.
We may see, and we'll talk a little bit at the end about state. The state may be covering the full amount. So you really want to know, is this being billed under the Medicare benefit? Or is
Yes.
this being billed under my state insurance? Or again, is this just being offered by a nonprofit organization who maybe received a grant to be providing these services?
That's a good point. Those are great
And
points.
yeah, the last time we talked a little bit about transitional care management, chronic care management, and PIN. You will see that as those a lot of times are focused more on that clinical medical aspect, right? Making sure that those needs are being met. Or when you see community health integration, it is more of that the social aspects, those social determinants of health. Because remember, that's how this starts, right? That an assessment was done, identified
Yeah.
those needs. And this can be built with chronic care management.
Mhm. Yeah. So a couple of things I was reading is that there is separate billing code for that social determinants of health risk assessment that the
Yes.
provider does. So if you're spending, an hour and a half, the provider can bill for that assessment, which I think is like up to 15 minutes, and then you can do it every 6 months. But then you can also bill then for the CHI, the community health integration services, up to whatever, time you're spending. And then you're right, it's 60 minutes. And then if you're spending more time, each additional 30-minute increments. So I
Yeah.
think that's good to know. Um, Perfect. Let's see. Okay, so now let's talk a little bit about Arizona. And because this is, like you said, we've had this in Arizona and, going through our Medicaid program, which I think we have an acronym in a later slide, or no, it's here, the
Yep.
AHCCCS.
Access. Yep.
Yeah,
Or
we
we
say,
say access.
but
Yep.
it's the
That's how we say
Arizona.
it here. Yes.
Yeah.
Yes.
Arizona
Yep.
Healthcare Cost Containment System. It's like, oh, really, Arizona? Do we need that many letters? But
Right.
cost containment system, which is our, implementation of Medicaid. But tell us a little bit, yeah, about how the community health worker came to be in Arizona.
Yeah, sure. So, in our patient advocacy world, we started hearing more and more, right, about community healthcare workers in 2023 and 2024. And for myself, I was like, well, yeah, they've been around for a long time.
Yeah.
So that's why I sort of wanted to talk about this. And that's really knowing, and the reason is because I live in Arizona and I've been practicing, one as a nurse in Arizona for almost 30 years, and as a patient advocate since 2015, right? So
Mm.
I have seen community healthcare workers being utilized in our state. And really this started out with legislation, but it started out with legislation from our community. It's
Mhm.
that, we said this is needed, right? To have community healthcare workers and to establish an actual program, an actual structure to it, which is that education, the certification, and the licensure of community healthcare workers,
Mhm.
in a sense, like advocates, right? That's what we're sort of looking like. We're in that beginning phases of like, we have advocates out there. We know there's a certification, you know, um, Arizona really looked at that. Like, so what are we going to do about that? So happy to say, I feel like they were very forward thinking
Mhm.
with that, because then in 2023, CMS actually approved, the Medicaid reimbursement for these services, which is great. I mean,
Mhm.
it's needed to be
Mhm.
identified at that federal level,
Mhm.
and to be able to bill um, access for these services.
Yeah.
So the one thing is, again, following those CMS guidelines, an actual person who identifies themselves as a community healthcare worker or community health representative, even if they're training, they're licensed, right? They themselves cannot bill Access Arizona's state-funded insurance or CMS. They, again, have to go back to that provider.
Okay.
So if somebody is a Medicare provider, right, the CMS, but if they are going to bill under the state, right, access, somebody who has access, they need to also be a provider of those
Okay.
services.
Hmm. Okay. Perfect. And we have, yeah, a little bit more about this. Okay, so this is good information if people want to look at what's going on in Arizona. So,
Yeah,
yeah.
and I would, Google your state.
Mhm.
And so Google your state and see, one, is there a Community Healthcare Workers Association? So if you go back to Arizona, if you go to Arizona's, you're going to see that this association has been organized for,
Mhm.
I would say, probably like at least 15 years. They have data going back to, they have been collecting data, they have been creating programs, resources, for a long time. So again, I would, Google your state and
Mhm.
know what your state offers. We also have a whole licensure site to go to see who is licensed. So where we're at in Arizona is, I could not find the exact number of how many people identify themselves as community healthcare workers, right? We know we have well over 1,000 community healthcare workers. The last data I found was 2015, and there were over 1,000 then.
Okay.
We're just catching up though, right, with the licensure.
Mhm.
So, and the training and the licensure. So in April of 2024, we have 362 licensed. I think we're going to see that now, um, get up to the thousands of
Mhm.
numbers,
Mhm.
because you need to be certified and licensed in Arizona in order to get reimbursed by Access. But that just happened in 2023. So it takes some time to catch up.
Mhm. But this is great. I mean, now that it's, covered for whether the patient is, covered by Medicaid or Medicare now, I mean, there is reimbursement for those two options. And for someone who's uninsured, they could, apply and maybe they
Exactly.
get Medicare, maybe, Medicaid, depending on their circumstances. And it just does help create that workforce that's needed. I mean,
Exactly.
people want
Yep.
to do this, they have the skills, the ability, they could get the training, certification, licensure, but to be able to know that their services are going to be reimbursed and it does help just create that, again, someone else said it, not me first, but that durable
And
workforce that we
workforce.
need,
And
that patients
that
need.
is actually why this started to be established, right? So we identified that we have a shortage of caregivers, right? And so we sort of needed a pathway for them, right?
Mhm.
To go, okay, well, how do we create a pathway? How do we actually create a workforce around this and make it a profession and a
Mhm.
livelihood, right?
Mhm.
And so that's what we're seeing, is this is the pathway, is they may start out as a caregiver, or a volunteer at an organization, right? And they go, you know what, we really identify that you would be phenomenal as a community healthcare worker in our office, in our organization, in this program that we're offering. And here's what this looks like. You attend training, right, for this long, online. You do hours, right? You act in the role. So you have the hours, you get certified, you get licensed. So it establishes that sort of ladder of becoming a profession, which is just exciting. That, when especially people are looking for something to do and they identify, they're like, I love helping people. I love working with people. You know what?
Mhm.
Have you ever thought about being a community healthcare worker? And here's some, places hiring.
Yeah.
And I'm sure, again, you could go to Google or Indeed and put in community healthcare worker where you live, and it will give you an idea of, wow, these are the places that are actually implementing these
Mhm.
type of services.
Yeah.
So in Arizona, it's just been incredible to watch it evolve. And it's a really just exciting
Yeah.
to see.
Yeah. And I think one thing we didn't mention, if people are curious, is the reimbursement rates for through the Medicare benefit is about $80. And again, it varies in different places, but about $80 and for that first hour, the code for the first 60 minutes, and then about 50 for, the 30 minute increments thereafter. So yeah. Yeah. All right. Let's see. Did I go the right way?
Yep, you went the right way. And
Okay.
I just included this because I sort of mentioned it, right? Is if you do a search for a job,
Mm-hmm.
where are you seeing
Oh,
these
good
type of
idea.
workers?
Yeah.
And so here in Arizona, we have it where you can go to the site and actually will provide a map, right? And then you just sort of scroll over the thing and it will tell you the name of the place. But these are the type of places, right? We're going to see them in actual practices, like we mentioned, primary care, physician offices. But we're
Mhm.
also going to see them in behavioral outpatient clinics, right? That they offer community healthcare worker services, various types of clinics in your community, right? So there might be a clinic who offers diabetes education, so they may have community healthcare worker programs. They may be offering community health integration under that clinic. I've talked a lot about rural health centers. We'll
Mhm.
see those where they're doing education on nutrition, right? And again, they may be offering and billing under CMS and or the state funded insurance. Um, Hospitals, other clinics, physician assistants might be offering programs. Nurse
Mhm.
practitioners might be developing a practice, right? They might
Mhm.
develop a practice and they may offer aspects of this.
Yeah.
So I just wanted to include it just to give an idea. It's it's interesting and it's innovative.
Mhm.
Very
Absolutely.
innovative. Yep. So
Okay.
our
Perfect.
resources. Yep.
Yeah. And it looks like I clicked on one. We have a different color there. Um,
Mhm.
uh, yeah. So these are some resources. The very last one is our resource list, the PDF that we've put together. And then the other three, we have the links. So we'll put the links to all of these in the description at the actual YouTube video. So you should be able to get, easy access to them, and you can learn more about, what we've been talking about, see what they say. Um, yeah, it's very
Yeah.
exciting. So this has been great, Melissa. A lot of good information
Yes.
about community health integration through CMS, and what it has looked like at the states too. I mean, with Arizona as
Mhm.
a perfect example of what we've been doing here. Anything else you want to add or tell everyone?
Yeah, I'm just very excited that you're all watching us. Again, we invite anybody that is interested to contributing, wants to have some discussion, dialogue, please reach out to us. You can reach out to us at Jennifer@bridgehealthadvocates.com, or myself, Melissa@bridgehealthadvocates.com. But we love talking about this stuff, so please reach out to us if you have any
Yeah.
questions or want to have some dialogue.
One thing I forgot is just what do you see, for independent patient advocates in relation to this in the future? Is this something you see? I know, that we would offer or we would somehow be connected to this, receiving billing in this manner, or what do you think?
Yeah, I think that's why we're doing this, right? It's just sort of trying to figure out, okay, how before you think, oh, can I do this? You really have to understand it, right?
Mhm, mhm,
So, someone like for me in Arizona, this has already been happening, right?
mhm,
So I really identify myself as a nurse patient advocate in the community,
mhm,
and I work with community healthcare workers. So I've already been working with them. I don't identify myself as a community healthcare worker,
mhm,
because my role is just a little bit different. Do I do a lot of overlapping things? Absolutely.
mhm.
But would I utilize, somebody for my client, right?
Right.
They go to their primary care. I'm with them. That assessment is done. It's identified. I'm thrilled, right, that the physician identified that we have these needs and that, you know what, they have somebody to help,
Yeah.
right? And I would work along with. So, again, it's, innovative, and to think about what is your role as an advocate and, um, you know, and how do you identify yourself as
Yeah.
a patient advocate?
Yeah. Perfect. Perfect. Well, it's been a lot of fun talking about this. Next week, we will do the last discussion that we'll have. We'll kind of wrap it up and go through a little case scenario, actually. So a patient who, maybe has a new diagnosis or change in their illness, and we'll go through that and kind of what services they're eligible for and what that looks like with the new health equity services. So stay tuned for that. You guys
Yes.
can subscribe to our YouTube so that you'll get the notification. You can get a notification when we put a new video up there. And then that goes for other things. We'll tease some other things that we're going to be talking about, HIPAA, which I'm really excited for, and just everything that we can patient advocacy related, that's, useful and relevant, current topics. We'll put them up there. So hopefully you guys find that interesting, get some value out of it. But thank you so much for
Yes.
watching. And please, like Melissa said, let us know if you have any questions or any input, anything you'd like to add to this. We're happy to hear it.
Yep.
Thanks,
Thank you,
everyone.
everyone.
Bye.